morning to everyone. Yes, I partially live in Miami, but I'm come on behalf of Mexico and Canadian. It's very important to mention this when I'm in Latin America. Thank you very much for receiving us in Lima. In particular, I would like to thank my colleagues and friends, Eliana, Tanya, for their support with the Lancet Commission and the organization of this major event. To Joe Batista and the Grunenthal Foundation, and of course, thank you so much to the ministries and leaders in health of Latin America who are here with us. It's a great relief of pain that we all feel, being able to have the ability and dedication by all of you in the health sector with us. I'm going to share with you the results, a summary of the results of the Lancet Commission. There are several copies which will be arriving today, so you can have it at hand in print, or you can download it from our webpage from the Lancet. It's free of charge, you just have to register. Now you're gonna go by the presentation, it's in orange and green. Our report is called Alleviating the Access Abyss in Palliative Care and Pain Relief, an Imperative of Universal Health Coverage. I would like to acknowledge all the collaborators and authors that made this possible, in particular, Drs. Farmer, Crackery, and De Lima, who are the leading authors of this publication. These are the first lines of our report, and I would like them to read them together with you and put yourself in this place through these words. Imagine your final month, weeks, and days of life. Like most, you probably hope to be free of pain. Consider, however, a scenario in which you and those who hold you dear face those painful days with no access to the palliative care that could alleviate your suffering. This is Ivan Ilyich from Tolstoy. But Ivan Ilyich from Tolstoy was 1886. He had no opium to calm fear and agony. This is unimaginable for you? Yes, probably yes, but this is the reality for most of the people who... This is how we start our report. A report led by the University of Miami and Harvard, an example of how to make the diagonal approach. We put together health systems and global health experts with palliative care specialists. In total, 33 commissioners and 61 co-authors of more than 25 countries who worked and signed this report. There are 5 key messages, which I say in Mexico, this is the goal. Number 1, alleviate the burden of pain, and this is an imperative of global health and equity. The countries of high income acknowledge and respond to this request, but the poor countries still don't have access. Number 2, there is an essential package that is accessible for interventions in palliative care and pain relief, and this package may reduce considerably the burden of preventable suffering, and universal access is feasible to that package. Through the universal coverage in health, the countries in developing countries have large opportunities that most of the time are ignored in order to improve the welfare of people in poverty levels and with a modest cost by financing and offering universal access to that essential package. Morphine. The anchor of this package, and we emphasize here the access to what is off patent. This is oral, immediate release oral morphine, and injectable morphine is the important component of this package. Training of health personnel is key to guarantee safe access and universal access. Number 4, the collective, global, and balanced action is essential in order to achieve universal coverage for palliative care, both in order to prevent the non-medical use as well as to secure the effective access to essential medications, including opioids, for pain relief. And number 5, we require evidence-based tools to define priorities, measure the global need correctly, and to guarantee efficacious follow-up and monitoring by the countries of our world. Those are the 5 key messages. And now I'm going to share with you the evidence that we have of our new index about serious health-related suffering, SGS or SHS in English, the unmet need for palliative care, the interventions, this essential package that we have developed, and also the possibility of strengthening health systems. And we are working in the implementation and some follow-up steps. We define a new indicator, which is the global burden of serious health-related suffering, SHS. In order to create this index, we analyze the health conditions that cause the most suffering and need for palliative care. And there are 20 of these. We also analyze 15 symptoms, 11 physical and 4 psychological, and that gives us the days of suffering in the world. So we have people and we have days. In green or we have highlighted the ones that have the highest burden in bold. Without going into details and to explain how we organize the information, you can analyze it by death or by patients. And the total of people, we're talking about 25.6 million of death, 35.5 million of people who live with pain and suffering, and a total of more than 61 million people every year. And this can be analyzed by health condition. In addition, these same indicators can be analyzed by symptom, both physical as well as psychological. In summary, the global burden of SHS in our world, speaking about the physical and psychologically specifically, are 25.5 million deaths. This is 45% of the total of deaths that we see worldwide. In addition, we analyzed, and this is the minimal estimate, people who live but don't die with this type of suffering every year, another 35.5 million people. In total, more than 61 million people worldwide, more than 6 billion days of suffering. And our estimate is that 80% has no access, and these are the ones who live in low and medium income countries. It is important to point out that within this group, we're talking about 5.3 million children. 99% of these children live in medium and low income countries, and that almost 90% of the mortality of these children is avoidable with reasonably simple interventions. Speaking about Latin America, 3.3 million people every year suffer this SHS that requires palliative treatment. It is concentrating cancer, dementia, liver diseases, lung diseases, HIV. And we have a summary of some of the countries that we have in our region who are represented in this meeting. The database is available for you and available for all the countries in our region. Against this need, we are looking to analyze what can the world do, the health system, to satisfy needs. And our tracer is, of course, pain and the access to morphine, speaking about oral and injectable morphine that's off patent. This information are the most inequality for hundreds of years of people who have studied public health. We have seen all the commissioners saw them in their lives. 50% of the world population, the poorest of the poor, receive less than 1% of global morphine. In contrast, 10% of the rich of the world population receive 90% of morphine. This is the map of access for palliative care of morphine, measured in terms of oral and injectable, that reaches each country in the world. You can see that three large countries, Western Europe, which is our benchmark, and what has impressed those who read the report is how the rest of the world disappears. The market in India, where there's only 4% of what is needed, just speaking of satisfying pain and palliative care associated symptoms. Our region also disappears. It is the only country in blue, Argentina, that according to our data can at least satisfy the needs for palliative care. And I understand that this is a case that we need to study in depth in these days that we're here together. In Latin America, and here I'll show you two indicators. The first one is the percentage of unmet need, speaking only of palliative care related to severe health conditions with 20 conditions and 50 symptoms. But in addition, we did an analysis uses as the benchmark or gold standard the average for Western Europe. In Latin America, there is sufficient morphine to satisfy, or opiates for pain, sufficient to satisfy just 1/3 of the need related with palliative care. When we use the European standard, we're talking about 4%. How do we solve this situation? Thinking as experts in global health and health systems is through an essential package for palliative care and pain relief. This package includes medicines, medical equipment, and human resources, the basic needed, so at each level of care, primary, secondary, and tertiary care, provide palliative care and what is needed for pain relief. The design of this package follows the effort by Dr. Dean Jamieson in disease control priorities. You can study it as part of the essential package of universal coverage for health. We as Commission are demanding that under the frame of the goals for sustainable development, this package be universally accessible for everyone for 2030. The cost of closing the gap is perhaps the part of the analysis that most surprised the world because actually it's so cheap. Here you see data of how to close the gap in morphine access in the world just for palliative care. At current prices that the countries are paying $600 million. We can work that topic with prices and talking about medications off patent. By doing that and using the best international prices, this can be reduced to $145 million. We need to give context to these numbers. This is the cost of a hospital. in a medium-sized city in Florida per year. And this is the cost of closing the world gap and alleviate pain. The information for children in low-income countries for me was quite impressive. When you are participating in a panel, you say, if I give you $1 million, what would you do with that $1 million? As someone who works in global health, sometimes I say, what would I do with $1 million? It's a question easy to answer, apparently, but I have the answer. Because with a little bit more of $1 million, we can guarantee access of medications. That doesn't include training, etc., but at least of the medication itself to all children in low-income countries who have severe, serious suffering. The essential package is also quite accessible. Our estimated, and this is based in information from Mexico and from some other countries, is 1% of the per capita health expenditure for the essential package. This is just 2 to 3% of the universal coverage for health that the disease control priorities propose to the world. Palliatives is a small portion of what they have to finance in the countries, especially small, if we can achieve the prices that the countries should face and have for those medications, and if we guarantee universal training of those who study to be health professionals. How can we do that? I know that there's another presentation later on about the organization of health systems. Here I would like to highlight that we can follow Dr. Julio Frank's model, who is one of the leader commissioners of this report. Julio has a model per functions: rectorship, financing, care, human resources, information, and research. And in this inform, we apply these for health global institutions as well as for countries and health systems on how to achieve the use of universal coverage in health to guarantee access to pain relief and palliative care, and how to do it in a way that it can help us to strengthen the health system as a whole. For example, thinking that in achieving safe access to pain medications is key to improve the platform that has not to do with palliative care. Through palliative care and pain control, in other words, we can achieve the diagonal approach that strengthens the health system and reduces the cost compared to efficacy of intervention, such as the essential package for palliative care. There are a number of recommendations, as I mentioned, function per function, of what needs to be done by a country in order to strengthen their system, specifically in terms of palliative care and pain relief. For example, guarantee that national health programs has palliative care. Guarantee that a specific program, vertical programs for cancer, lung diseases include palliative care. To guarantee that every person who studies medicine, nursing, to be health professional has to receive in their undergraduate training. That's how we study medicine in Latin America. They receive basic courses in training of the management of these medications and palliative care. And we're also insisting to all of these countries and throughout the world that without the access to palliative care and without access to pain relief, no country can talk about reaching universal coverage in health. With universal health coverage, we not achieve the goal of sustainable development number 3 that we have for this millennium. Without going into more detail, we study 20 countries throughout the world. One of them is my dear Mexico. and we study the case of Mexico, and I will share this data with you because up to 2013, we haven't done much progress in terms of palliative care and pain relief. Under the frame of a country who had declared health universal coverage, we found ourselves in a very unfortunate situation of no access to basic morphine or palliative care. We generated, and this is a lesson important for all of us, we generated a advocacy group from several NGOs, cancer, other diseases, those who advocate for the rights and capabilities of those who study medicine in nursery, a large group. We work with Human Rights Watch in collaboration with clinicians and researchers as Silvia Allende, and I think that we help to push the public policy that was implemented from the Secretary of Health. The law was enacted, and we added palliative care and pain relief services to the crucial package of popular insurance. We established the electronic prescription in addition to the written prescription. That was a dramatic change in terms of regulation and stewardship, and we're finally starting to train physicians, nurses, and second level.
Nosotros seguimos.
We continue working, pushing, and promoting with this meeting launching for Latin America and Peru of our Lancet report. We continue working in the implementation of the recommendations. We have a working group for the implementation of a statement called Action that was published in 2018. That group is anchored by the International Association for Hospice and Palliative Care, the IHPC, under the leadership of Liliana and its board, and we were able to work with all the regional and international groups for palliative care. We have a series of toolkits and additional resources that are available for you: maps, fact sheets, information, the information that we have available to work in the web, and we are also at your disposal to work with you and to strengthen the evidence of the data that you have for each country, specifically, and for example, for the essential package costing, which today is not cost for all countries. This is something that we are ready to help, and we would like to work together and to help. So these tools, such as the essential package and information about strengthening of the health systems, can be seen implemented within your own countries in order to achieve a Latin America that's painless. Thank you very much.